Hi, what we're going to talk about right now is our HIV coding guidelines. Those are found in section 1.C.1.A of your official coding guidelines. And the first one that we're going to talk about is number 1 here, code only confirmed cases. So what does it say? It says code only confirmed cases of HIV infection or illness. This is an exception to the hospital guidelines section 2H. In this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. So let's break it down. This is really pretty straightforward. Basically what this is saying is unless the doctor says in the chart somewhere that the patient is HIV positive or has an illness that is related to HIV and we know is related to HIV, then you don't code HIV. Why? Because there's such a stigma still attached to HIV infection that if we do, it could be very damaging to someone's life. And what their their job, it just could be a real problem for them. So when it says here that this is an exception to the hospital inpatient guidelines section 2H, that means if you think back to your coding guidelines where you talked about being able to code something that was probable, rule out, suspected, anything like that, as if it really existed. For instance, patient, it's documented the patient has possible CVA or rule out CVA, documented by the physician. We're going to code that as if the patient had a CVA because what they're saying is they really didn't know if they have it or not. They can't tell, they can't confirm it, but they did the testing, they did evaluation, they treated for it more than likely. So, and they're probably going to have continued testing and treatment after their discharge. Therefore, we would code it as if it existed. Here we're not doing that. We do not do that. We do the exact opposite with HIV. All right? So if you look at the example, and I'm in your book on page 182. If you ever wonder where I am, I'm right here. This is where the pages will be. Patient with possible HIV or human immunodeficiency virus. So even though it would be acceptable for us to code something that says that it's probable or suspected, when we're talking about HIV, we do not, and we wouldn't code HIV. The code for HIV is B20. We would not code that. You would have to actually query the physician, okay? Let's look at number 2, selection and sequencing of HIV codes. So a patient is admitted for an HIV-related condition. Let's say a patient is related. Let's read it first. If a patient is admitted for an HIV-related condition, the principal diagnosis should be B20, HIV, disease, followed by an additional diagnosis code for all reported HIV-related conditions. So let's look at the example. The patient was admitted for treatment of Kaposi's sarcoma of the skin. Now, we know medically, and if you were to look up Kaposi's sarcoma, it is what we call an AIDS-defining illness or an HIV-related illness, meaning that HIV, you don't get Kaposi's sarcoma unless you are HIV positive. All right? So if that is the case and you have Kaposi's sarcoma or you have an HIV-related condition, then you must code B20. That's the underlying cause for it. So you're going to code the underlying cause. This is a manifestation and etiology issue. Okay? So our etiology is B20, the HIV or the AIDS, and our manifestation is C46.0 or the Kaposi's sarcoma. Okay? Simple enough. So now what do you do if you have a patient that comes in with HIV and they have an unrelated condition that they're admitted for? And what it says here is if a patient with HIV disease is admitted for an unrelated condition, such as a traumatic injury, the code for the unrelated condition, e.g. the nature of the injury, so if they have a broken leg, should be the principal diagnosis. Other diagnoses would be B20 followed by additional diagnosis codes for all reportable HIV conditions. So let's look at this example. Initial encounter for traumatic closed fracture of the left femur in a patient who has acquired immune deficiency syndrome or AIDS. So if you look at this, they were not admitted because they were having trouble with the AIDS. They were not symptomatic necessarily enough of AIDS to be admitted. So they had a broken leg that needed to be treated. They needed to be admitted for that. That is our S72.92XA code. That is the fractured femur, all right? Followed by, because it is important for us to know, the HIV code, the B20 or the AIDS code, all right? Again, if the physician hadn't said, let's say if the physician didn't say whether or not they really had HIV, you didn't need, but there were indications in the record, you would not code this, but you would go back and query the physician. That ties in with this first guideline that we talked about, okay? So now let's talk about C. Whether a patient is newly diagnosed. So what does that mean? Whether the patient is newly diagnosed or has previous admissions or encounters for HIV is irrelevant to the sequencing decision. So it doesn't matter. It doesn't make any difference if they just got diagnosed 2 hours ago, 2 minutes ago, or if they were diagnosed 20 years ago. That doesn't have any relevance, because you will find people who have had an HIV diagnosis for 20, 30 years, and they're still living a very happy, healthy life. For example, Magic Johnson has had an HIV diagnosis for a very long time, and he's still living a happy, healthy life, does not appear to have any issues. Or you could have someone who has HIV infection with full-blown AIDS who is on their deathbed and they were only diagnosed 2 weeks ago. So it does not have any bearing on what the sequencing is for coding, okay? Let's look at D, asymptomatic human immunodeficiency virus. So what is that? So Z21, asymptomatic human immunodeficiency virus or HIV infection status, is to be applied when the patient without any documentation of symptoms is listed as being HIV positive, known HIV, HIV test positive, or something that is similar in terminology, okay? That would be typically if there's they have a test that comes back that is positive from the lab, but they don't have any symptoms at all. Maybe they came in, maybe they were a pregnant woman and they were getting their first round of prenatal blood drawn, and incidentally they always do an HIV test on everybody, and oh, look at that, you have HIV. No symptoms, no issues, no nothing, never knew, but they have an HIV positive test. In that instance, you're going to use Z21 as the code to let everybody know that they are in HIV infection status. If there is the word or term AIDS used anywhere for a patient, or if they, in their record, or if they are being treated for any type of HIV illness, so they go back to Kaposi's sarcoma, they're being treated for that, or if they have any other condition that is as a result of their HIV positive status, they no longer are just asymptomatic, right? Now they're showing symptoms. So now you have to switch to using B20. In this case, you will never go back to use Z21 ever again. From this point on, you will always use B20 for people like this, okay? So, example, the patient's HIV test last week was positive. The patient is asymptomatic. You do Z21, okay? Sometimes we have patients that have inconclusive HIV tests. So a patient with an inconclusive HIV serology, but they have no definitive diagnosis or manifestations of the illness, but the physician suspects that they have it, you can assign code R75, which is Inconclusive Laboratory Evidence of Human Immunodeficiency Virus. That's a, a good example would be of an inconclusive test would be if you do a home pregnancy test and it's supposed to, there's supposed to be a bright red dot if you're pregnant, but it never turns bright red. It kind of turns a light pink, Are you pregnant? Are you not pregnant? That would be inconclusive, okay? So previously diagnosed HIV-related illness, here we are. Patients with any known prior, and this is an important one, prior diagnosis of an HIV illness should be coded to B20. Once a patient has developed an HIV-related illness, the patient should always be assigned code B20 on every single subsequent admission or encounter. Patients previously diagnosed with an HIV illness of any kind should never be assigned R75, which is the inconclusive serology, or Z21, which is the asymptomatic HIV infection status. Never, ever, 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 ever. So once they have some type of an infection, that's it. They've got the infection. Okay? So here is an example. HIV patient with a prior history of PCP pneumonia. You're going to give them the code B20. Even though they may not have it now, it could have been 3 years ago, could have been 10 years ago. You still are going to assign B20, even if they haven't had any other symptoms during that time period. Don't forget that. That's a very important, very, very important one, guideline to remember. So let's talk about HIV infection in pregnancy and childbirth. So when you're talking about pregnancy and childbirth and the time surrounding that, the puerperium, it changes everything. So we need to, there are special guidelines for those. So here's the guideline for HIV. During pregnancy, childbirth, or the puerperium, a patient admitted or presenting for a health encounter because of an HIV-related illness should receive a principal diagnosis of O98.7- human immunodeficiency disease complicating pregnancy, childbirth, and the puerperium, followed by B20 and the codes for the HIV-related illnesses. Okay? So the idea is, if you look at the example, the patient is 20 weeks pregnant and is admitted for treatment of esophageal candidiasis due to AIDS. So her code, this patient's code would be, principal diagnosis would be O98712. And that is the code of HIV complicating pregnancy or childbirth, because it is a complication, but it's important to know first and foremost that patient is pregnant. Okay, then we're going to follow it by B20 for the HIV. Then we're going to follow it with the esophageal candidiasis. All right, that is letting you know. Now this code right here, Z3A.20, is telling us how many weeks pregnant she is, and you need to look for that. That's gestational time. You need to code that. That needs to be coded. So anytime you come across a pregnant mom with anything that's complicating it, you need to, if they give you the information, you need to code the gestational weeks. All right? Now, what if we have one where the patient is asymptomatic? A patient at 39 weeks delivered live-born twins vaginally during her hospital stay. The mother's HIV has remained asymptomatic. So we're going to code 030.003, all right? And that is going to be the delivery, okay? And then we're going to code 098.72. Now the reason this is the HIV code. Now the reason we don't code that principal is because she didn't come in because she had any HIV issues. She came in because she was popping those kids out, right? Okay. And then we move on with the rest of the codes. Mother has been HIV, has been symptomatic, okay? So we have to just pay attention to the fact that childbirth changes everything. All right. Finally, we're going to talk about encounters for testing. So anytime we test for HIV, we code that. So let's read what it says. If a patient is being seen to determine his or her HIV status, use code Z11.4, encounter for screening for HIV. Use additional codes for any associated risk behavior. All right, so let's talk about that first before we move on. So the example that they give here is because of high-risk homosexual behavior, patient is seen in the clinic for HIV testing. Now, Don't take offense. High risk, it could be high risk heterosexual behavior. It's just a way of tracking for data. And remember, that's what we're looking for is data. So in this instance, we have a person who lives a homosexual lifestyle and doesn't use condoms, let's say. Okay? Could be, again, it could be a person living a heterosexual lifestyle who doesn't use condoms. In this case, it's homosexual. So what we're going to put here is Z11.4. That's the fact that, hey, they came in here to be screened for HIV. Then Z72.52 is the high-risk homosexual behavior. It identifies why they're coming in for this, okay? If a patient with signs or symptoms is being seen for HIV testing, code the signs and symptoms. An additional counseling code, Z71.7, HIV Counseling, may be used if counseling is provided during the encounter for the test. So let's look at this one. Example, the patient returns for test results that are negative and is counseled regarding HIV prevention. So here, well, I guess I don't really have a very good... Let's look here. Let's skip down to this one first. The patient returns for test results that are positive and is asymptomatic. She is instructed regarding symptoms to watch for and means of prevention. So she came back in for her test results. She's asymptomatic, but she does have positive results, Z21, and we're going to give her Z71.7 because we're giving her HIV counseling. If the patient comes in for their test results and they're negative, we're going to give them HIV counseling because, hey, there must be a reason they came in for testing. Perhaps this high-risk behavior. Therefore, we're going to counsel them that, hey, you need to use condoms and you need to be more selective. You need to be careful. All right? So that is HIV testing in a nutshell and the guidelines. Hope this helps.